Doctors and nurses of Reddit, what have been your "why didn't you come in sooner" moments? Story 1. Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy part to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care, and was afraid to take the wraps off even after his foot started to stink. By the time I saw him, his skin had kinda liquefied. Earlier on in my career, I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that, and he said about 2 years. Next time I saw him, he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you're diabetic and can't feel the bumps and scrapes, please check your feet regularly. Story 2. Doctor here, might be a bit late and will probably be buried, but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off, and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead, he died 3 weeks later. Story 3. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior, and now it was really itchy. Old gentleman, didn't drive, lived alone. Got to his house, unwrapped the ungodly swollen leg to find that he tried to superglue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. Story 4. Guy came in with a dead leg. Waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow, but it was way late for that. Guy had several clots in his lungs and legs. Undiagnosed atrial fibrillation. He couldn't believe we were going to amputate, kept asking me what else I could do. Go back in time a week ago and come in. Kinda around when it turned blue. Story 5. Years ago, as a nursing assistant on an oncology floor, we had a guy admitted because he had had an erection for several days and had lost the ability to pee. His bladder was close to bursting and his poor junk was, think microwaved hot dog. Really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years that had over time become infected, developed MRSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face, and was starting to lose his other eye. You could see part of his fucking skull. I don't know why he chose to leave it untreated, and I have no idea how long it took to get that bad, but I will never ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose, and cheek. So, if you ever meet a very grumpy dude with nothing but a mouth and one eye, know that this is way better than the alternative. Story 6. This happens all the time. People have a big stroke at home and can't move an entire side of the body. They wait several days thinking it's a flu or something. Nope, not the flu. Just a large clot in the brain that could have been reversed if you came in right away. Story 7. Patient here. For 6 months in 2014, I complained to my family doctor that it felt like I swallowed a super ball and it had gotten stuck, and that walking to the mailbox and back caused me such labored breathing that I needed a 10-minute break to catch my breath. I was also coughing up quite a bit of blood from time to time. He was getting annoyed by my complaining and would just keep prescribing steroids. He told me that because I was fat and a smoker that I needed to accept that I had COPD and that was going to be my life from now on. I finally said, look, send me for whatever type of test will look that far into my throat, and if it comes back as nothing I will stop complaining. 3 weeks later I had a sonogram and they asked NE to stay for another test, and then they started freaking out and said I had to go from the testing facility to the ER in an ambulance. Their hospital refused to see me, so they sent me to a different one that also refused to see me. We still had no clue as to what was going on. I finally get taken to my current hospital/medical center and they tell me I need emergency surgery to try and remove the cancer tumor that is growing inside my airway. I only had 4 millimeters, a coffee stirrer, to breathe through. Had I not made that deal and had just accepted that not breathing was my new normal, I would have only lived another week or two. My family got a new family doctor. I was diagnosed with terminal stage 4 cancer, throat, lungs and spine in April of 2015. I am losing my fight though and started home hospice 2 weeks ago. I put up a good fight and I am so thankful that I didn't die in 2014. Story 8. Obligatory, not a doctor, but I have a story about myself. I got really sick really fast, but didn't realize it. I had stage 4 Burkitt's leukemia CNS positive, which is very important to know. Less than 100 people my age will get that cancer each year in the USA, so pretty uncommon. Anyway, I got super sick just over a year ago, and just happened to have a doctor's appointment scheduled. Went to the appointment and felt like absolute trash, sweaty, hot, lethargic, lightheaded, terrible heartburn and just tired. Also could barely breathe. My dad who was driving me to the appointment had to wake me up and I remember him saying, "Get up fat ass, we have a doctor's appointment to get to, you better be fucking sick." In his defense, he had no idea and neither did I just how sick I was, as 2 weeks before I was fine, working in South Carolina on a construction job. So we get to the appointment and I get blood work and an ultrasound of my chest cavity. The doctor saw the ultrasound photos and was stunned. Then saw my blood work and told me to get the fuck back to the hospital, as we left to go home and would hear the results later. Doctor saw 7 tumors on my liver, the biggest on the size of a grapefruit and the second largest the size of a baseball, and then saw my blood work was trashed. Diagnosed me with cancer and said it was a miracle I was awake, let alone walking and cracking jokes. Only found out later that Burkitt's cell can double in size within 24 to 48 hours. Doc wondered why I hadn't had problems with my monster tumors before since I only scheduled the appointment to fix heartburn. Story 9. This has happened a few times, actually. But I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. So basically, we tell ladies to avoid intercourse until a doctor clears you, and well, her spouse kept insisting that Friday night she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all weekend long. Came into our clinic, blue in the lips and fingers, and her hemoglobin was 4, normal should be 12 to 15. She didn't want to be a bother, so she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. But, like I said, this isn't the first time I've seen that, so for the love of God, if homeboy is begging for it after you just had a baby, maybe he needs a lesson in self-control and a bottle of moisturizer. Story 10. Had a hysterectomy a couple of months ago. Doctor told me if I had sex I would pop the stitches and my bowel would fall out through my vagina. Needless to say, I wasn't in the mood after that. Story 11. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years, so the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds, the doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. Sad face. Story 12. I've seen a few over the years, and they generally fall into the category of, if it's not diagnosed then I can't have it, or I didn't think it was that bad. As a medical student I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years. But, if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category I've seen a few cases of Fournier's gangrene. Pretty much obese, male diabetics that had a pimple/sore that started in the pubic region. By the time they come to the hospital it's a raging infection where the treatment is basically to cut away everything in the pubic/groin region down to the muscle layer. That little sore didn't seem like much at first. Story 13. Coworker was having issues for months with eating and indigestion, then she had started throwing up everything, liquid and solid, for a week. Another coworker convinced her to go to the ER, and I went with her. Ended up her intestine was twisted and she needed emergency surgery. She waited so long because her mom died in a malpractice incident when she was a teen and now she doesn't trust doctors. Story 14. Not a doctor/hospital staff, but my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago, he was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge, like volleyball size huge, and he may have survived if he came in sooner. By the time we got him to the hospital he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. Story 15. I am a doctor and while working in A&E we had an older chap, possibly in his 70s, who several days prior to presentation had a sudden onset severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day he started to lose the use of both legs and by the time he came to hospital had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event, developed a clot which his heart had pumped out, it went down his body, broke in half and blocked off the blood supply to both legs. He literally had dead legs. I don't know what ended up happening to him, but there was no way to save the legs and I reckon the outcome was very poor, if not fatal. Story 16. I was with my kid in emergency department, allergic reaction, and in the waiting room there was a family with a 2-year-old. Apparently that kid stopped walking and lost the use of her legs. 3 days before. They waited 3 days. Story 17. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound, don't image search that she'd had for 2 years and hadn't gotten medical attention for. A biopsy and a PET scan later she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia so it wasn't a money issue. Just sad. Story 18. Obligatory not a doctor. I was sitting in a hostel with an emergency nurse and an emergency doctor that had just found out that while they worked on different continents, they did similar work. We were happily chatting along and this older guy walks in. He overhears that they're in the medical field and comes up to see if he can ask a question. He shows them his leg, that's got large black spots on it everywhere below the knee. Both the nurse and the doctor look at it and immediately go, "You have to go see emergency services. That leg is necrotic, you'll lose the leg if not your life," and the guy goes, "That's what my doctor back home said too. But the leg feels fine, I'd know if it was dying." You are wrong. Besides, I'm not gonna ruin my vacation by seeking medical treatment, which left me wondering why he asked in the first place. He goes to sit at the bar and over the course of the evening both the nurse and the doctor leave the table to try to get this guy to understand that he may not have 10 days until he's back home, that he needs to have this looked at now without success. Pretty sure that if that guy made it to a hospital, they asked themselves that question. Story 19. Children's nurse here, my first week in pediatric ED we had a young girl, 6'7", come in with a really swollen jaw/face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse her mum told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. Story 20. Elderly woman fell at home and broke both femurs. Son thought she just needed to rest so he carried her to her bed. She laid there in her own filth for 3 days before anyone called 911. The son lives with her, and there's family next door as well. How? Why? Story 21. Had a patient brought in by her son who took care of her. When she arrived to our unit I performed a skin assessment, took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. Story 22. I work in orthopedics. A very common occurrence is a patient is told to follow up within the week. We like to see fractures between 5 to 7 days, and the patient will call on the 6th day and say, "I broke something and need to be seen tomorrow." This is frustrating because we very rarely have the ability to get a patient in next day, and if they had called the day of or the day after then we definitely could have gotten them seen. But my number one "why didn't you come in sooner" moment was getting a call from a patient who had broken their forearm 2 months ago and never followed up. I got them scheduled, they no-showed their appointment. Rescheduled, they no-showed. Second reschedule, they arrive with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had just come in, it wouldn't have been an issue at all. Blows my mind that they went almost 3 months without care. Story 23. Not me but my brother is an EMT for a warehouse. He recently had a guy come to his station saying something was wrong with his toe. So he asks him to take off his shoe, which he does. My brother was about to ask him to take off the bandage around his big toe before he realizes that that wasn't a bandage, it was his skin. Apparently, this guy dropped a 20-pound toad on his toe a week earlier and had been showing up at work anyway. They sent him to the doctor sent him to the ER. Diagnosis came back as a tissue infection as well as osteomyelitis, a bone infection. But wait, there's more. The guy come back from the ER and tells him that he doesn't want to go through the ER doctor and would rather go through his own insurance. My brother explained to him as best as he could that, as it stood, he was already likely going to lose his toe, and if he waited any longer to get it treated, he ran the risk of losing his entire leg. Not sure what happened after that, I just hope he got the point. Story 24. I was working as a surgical junior when my team was called down to A&E to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened and their intestine was visible to the air. It transpired that this was not something that had happened overnight, it had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings.